Hello, good evening, my dear friends. Today, I'm going to discuss or share an startup idea. The whole concept and the new term behind this idea is Metabopsy. And this Metabopsy, this startup idea will be focused to the nil, that is of human subjects. Can be healthy, can be of disease condition like cancer, diabetes. Human subjects can be subjected to drugs, medicine, like even for forensic applications. So this startup idea is to create a metabolic data card that is conceptually in the form of Metabopsy. And definitely nails as a biological material is non-conventional in comparison to like serum, urine, like biopsy tissues, etc. Okay. So the whole idea is for human subject, if the nails that is in the form of nail clippings, clipping of nails, those can be subjected to a method and process, and after a standardized method and process, a form of digital metabolite card will be generated that can be utilized by the various government agencies, health professionals, hospitals, and also can be submitted to the various AI-driven, artificial intelligence-driven, the social networking platform like Facebook, Twitter, etc. So that the data in the form of Metabopsy that will be created by using this particular startup idea, that can be directly submitted to the social networking site. So to create a very comprehensive AI-driven output in the form of a group of disease, a group of metabolic data card across the globe. And that is what the potential of what we propose in the form of the startup idea as nil Metabopsy. Okay. Definitely this idea is being originated, conceptualized at the Dr. D.Y. Patil Vidyapeeth, Pune, Dr. D.Y. Patil Biotechnology and Bioinformatics Institute, myself, Professor Nilesh Kumar Sharma, and Professor Sachin Sarode is also going to be a part of inventors and the coordinators. Now we have to give you the details of nil Metabopsy, what it requires, how it will work, and what type of the data is going to be generated. So let me go to the point. Yes, in this startup idea, as we know, like what are the requirements of this startup, what are the problems, and that solutions are needed. And by having this nil Metabopsy, what are the solutions are given to the society or to the industry or to the scientist or any stakeholders, right? What we have in support of nil Metabopsy, what uniqueness within the nil Metabopsy, what are the target market, revenue model, and growth plan of this particular idea. Okay. So the first we will start, okay, this is the startup idea title what we are proposing, NEL Metabopsy Health Services Private Limited, okay? And that is what the whole concept of Metabopsy, that is in the form of a digital metabolite health card of each and every individuals. And that is very, very cheap, non-invasive, no pain, no surgical procedures are required for this kind of Bopsy. What I use the word meta means metabolites. Bopsy means it can be a form of procedures. So here the procedure is non-invasive, non-painful, and simply it can be performed. And there is nothing like clinical expertise are involved, like in case of routine tissue biopsies, okay? Because it is based on the NIL Metabopsy. Now the next point is what it is NIL Metabopsy, right? As I said, so this NIL Metabopsy is less painful, simpler, less time taking, comprehensive blueprint of health conditions compared to an existing approach of biopsy, tissue biopsies, that is tissue and biological fluid based. This whole idea of NIL Metabopsy, once it is generated for an individual, those data can be fed or given to the AI-driven even social networking. So altogether, initially as a preventive, diagnostic, and also for prognostic, for healthy and as well as disease condition, like including cancer, neurodegenerative diseases, metabolic diseases like diabetes, inborn error of metabolism, and many more it can be. And the another is minimal cost and problems during the handling, the storage, and processing of nail clipping samples from the interested human subjects. Now, great. The second point is about the same, what is NIL Metabopsy? Again, the description is, this NIL Metabopsy, it will be like in a health data card. How the metabolites in the nails of any individual or any human subject, it may be healthy, it may be disease condition, it changes, during the long period of time, right? So even drugs, toxicity, medicine, etc., forensic sciences, it has the scope of NIL Metabopsy, non-invasive, pain-free, and the method and the process what is going to facilitate or achieve this particular startup idea is our own vertical tube gel electrophoresis, VTG, what we call, is our in-house tool, what we have developed. And tool is itself less expensive. Cost of the instrument is very, very cheaper, less than, you can say 500 rupees, right? And definitely the advantage of the tools, that is VTG, and also the advantage of the NIL, that is less chance of degradation, like the storage of routine biopsy tissues or the saliva or the urine is very, very difficult. But the NIL can be stored without any degradation, even at room temperature and without any expenses. Quantity of the sample, of the nail sample, is easily available, right? Like nail clippings can be of as desired, even though in our methods or in our proposed idea, we are not going to require huge amount of nail clippings, that is in the amount of, you can say, 10 milligrams, 20 milligrams, 100 milligrams is enough for the creation of the NIL Metabopsy digital health card for individual, right? The another, yes. If you look at what is the uniqueness, how distinctive this idea will be, like in comparison to the routine biopsy, that routine biopsy, if you look at, there is always issue in routine tissue-based biopsy is the degradability, transportation issue, applicability, etc. And those problems are going to be resolved if we are going to approach for the nil metabopsy. See, the startup idea nil metabopsy does not mean the scope and application of the routine biopsies are ignored. No, routine biopsy, it has its own importance, right, in the clinical or for the clinical doctors. At the same time, nil metabopsy is going to work as an additional informative, useful digital data health card by the use of novel methods, novel approach, and novel ideas. Now, other than uniqueness and the description of the nil metabopsy, in the existing approach, as we discussed, that like invasive approach, most of the routine biopsies, expensive, definitely it is expensive. It needs the clinical expertise, it needs very sophisticated equipment, etc. So those problems can be resolved and can be solved to an extent by the whole concept of this nil metabopsy. In comparison to the routine, biopsy, this like non-invasive or no issue of degradation, this method is going to have applications in other like forensic applications, drug, etc. And one more advantage, it is also important to be mentioned here, that sample can be collected from the rural and remote areas even without the issue of storage, or whether it is dry ice is required, cold storage is required. It's not required, right? So even from the long remote areas, nail clippings can be collected from the populations and can be sent for the nail metabopsy. That is also one of the advantages here. Then for any startup idea, like our startup idea, nil metabopsy, what is the requirement, even from the government of India? So there are 3-step requirement. One is requirement is, that registration has to be done with Startup India. For that registration, there is 2 mandatory requirement. One is the patents. The startup idea should be supported by the in-house patent from the inventor side, right? And that is what we have. So we have our own 2 patents related to this nil metabopsy already published and in grant process. The second thing is the proposed startup should have the attributes of like innovation. Look at here, improvement of existing product, services, and process. So in all this category, the nil metabopsy as a startup idea, it competes, it qualifies for all these criteria. That is why even for the government startup promotion scheme, it precisely fits, and it has very good future scope of inclusion within this type of the scheme from the government of India. Then what do we require also, other than all these awareness, sensitization? And you can also see one of the limitations of nil metabopsy. Initially, the human subjects in the society, they has to be sensitized. Why there is a need of nil metabopsy? What are the advantages will be there? What benefits they are going to get in their lifetime in regard to their health and etc. So definitely awareness is very, very important, and like awareness through a meeting with hospital, even community centers across the rural and urban areas, social networking, advertisement, and visiting rural areas, for discussion, for sensitization among the population, and also the stakeholders like hospitals, government agencies. If the forensic applications, we have the scope of nil metabopsy, so the police department, forensic department, they can be also approached and they can be sensitized on the importance of nil metabopsy. Then always there is a question, what we have in support of those ideas. What is the technology? What is the method? What is the process? So here that, as I have mentioned, so this VTG, we have
claimed as a new design or new innovative approach, and it is well supported. Here is the Indian patent application reference number, and here is the few publications that has been reviewed and well appreciated by across the health professionals or experts in the field of like cancer or the disease condition or the metabolite you can say discovery. So they are highly appreciated, and they have uh, appreciated in words that yes, this method is logical, scientific, and technically is strong. Then here is the whole GIF and the small video that is of method itself, how it works. So if you look at here, it uses very simple Falcon tube. If you can see through the GIF, one is outer one is 50 ml Falcon tube. It's very cheap. Inner one is the smaller diameter, that is 15 ml Falcon tube. So it gets assembled in a very easy manner, and it uses the polyacrylamide gel of 15%. If you look at here, and if you look at here how it runs within 90 minutes, or you can say 120 minutes. And here is the whole flow diagram. If you look at here, so this is in the bottom of the large outer diameter Falcon tube. This is where the metabolites are going to be eluted or purified. These metabolites are going to be submitted for the LCHRMS for the generation of metabolic digital card, or the information that can be given or shared to the patient, not in complex technical form, not as scientific form, instead of in a digitally simplified, and so that any individual or the human, they can understand what will be the significance of their nail digital card. Okay, so and always the question is, okay, what nail digital metabolic card is going to be generated through the nail metabopsy, how it is going to be accessible to the interested individual, how they can interpret, how they can look at, So in a simple way, I would like to demonstrate here how the data will be presented. So the data will be presented in a bar graph, or you can say the colorful, very easily to understand. And initially, the machine generated metabolic card will be converted into a presentable data or presentable number, so that any individual can have, like, for an example, I'm giving you one example how the data will be used by the individual or the patient. Like suppose for routine blood sugar test, we go to the pathology lab. So what is the whole rule? Rule is, for any blood sugar level, so if it is the benchmark like 180 milligram per deciliter, yeah, so like normal range is less than 140 milligram per deciliter, right? So if your blood sugar is going to come at like 180 milligram, then they give some inferences or the idea to the individual patient, right? Okay, so your blood sugar level is high. So simply through the nail metabopsy, what we are planning, the data, those will be given to the individual, that will be presented similar to the routine test. So the individual, they do not have to go into the details of how the VTG worked, how the other analytical instrument is going to work. They will have this particular in a simplified. And here is the example. What the data will be given to the patient. Here is the, from the nail metabopsy, like for example, a potential Alzheimer patients, right? So for potential Alzheimer patients, if a particular this metabolite like 5-HL is very critical, right? 5-hydroxylysine, okay, 5-HL. So this 5-HL, if the level within a particular individual is, for example, is 2500 AU, that is arbitrary unit, and the normal range is, for example, is less than 100 units per milligram of the nail. It is very important here. Look at here. Per milligram, it is defined. So the digital software or the digital the tool will be prepared in such a way that patients will have very defined information. Oh yes, in their nail, so this marker for the Alzheimer disease is of
2,000 unit or 2,500 unit, then they will be an idea that yes, the disease condition for the Alzheimer is in the progressive stage. They have to take care in terms of their dietary lifestyle or in terms of their medication and many more. That means if the person is unknown that whether the Alzheimer disease is progressive in his body, that can be given. So it is just an example. So any healthy patient or any disease condition patients, they will have their own profile in the form of NEL digital metabolic health card. That is of the whole concept of NEL Metabopsy. Correct. So, and likewise, many more. So like, for example, any drugs or any toxins are given to any individual for the forensic department. So the data can be generated from the nail because nails are non-degradable in comparison to the other tissue sample. So these are one of the added advantages even for the forensic department to have the better references whether those drugs or the toxins were present in a particular individual in their lifetime. Okay. Now, this is one of the representative of what we feel and what we have the idea that NEL Metabopsy is going to create data in this format or in this form. And like, one more surprising thing is that, look at here, NELs of any individual, it's very good. So it has the potential to have, like, if you look at here, in one of the patient, tumor biomarkers are detected. Even the routinely used steroidal drugs, routinely used non-steroidal drugs, like, you can say brufen, paracetamol, and all these kinds of the drugs are detected within any of the individual. That is surprising. And those informations can be useful for the prediction of, for the suggestion of whether any individual, they have gone through any medication, any drugs, any toxin in their lifetime. Look at here example. If you look very clearly, like it's one of the anti-cancer drug. It is like, if you look at here, brufen, NSAID drug. So tumor biomarkers like deoxyribonucleic, this is one of the marker for Alzheimer's disease. So it is just proof of concept, representative. So the one individual there, these NEL digital metabolic health card will be different in comparison to the other individual. That is what the power of NEL Metabopsy. Fine. Now the next question is, what is the applicability domain? What is the scope of this start about the NEL Metabopsy? As I said, NELs are not just for aesthetic purpose, right? NELs have the accumulation of several drugs, metabolites, and many more. And that is why, if you look at here, the scope of this definitely as a biomarkers of diseases like cancer, inborn error of metabolism, and many more. And in the field of, like, inborn error, diabetes, cancer, forensic applications is also one of the scope, right? Even in case of what I say, for any healthy individual, they can also be suggested or recommended to have at least once in their lifetime NEL Metabopsy. That is the whole point. Healthy subject also. So once they will have their NEL Metabopsy, information will be given to the particular subject. Oh, these are the status of certain metabolites. Those can be, even in near future, care should be taken so that prevention can be achieved for a certain, like diabetes or neurodegenerative disease or cancer or any other metabolic disorders. So our own paper, what we proposed recently, is also cited in one of the very recent paper, that is how the human NELs can be used as a biomarkers for the disease condition. This paper has cited our own recent patent and our recent paper. So now the next and last point is, customer. For this startup idea, what we are thinking, customers can be healthy, patients, local, national, international, and the customers can be pharmaceutical industries also. So the pharmaceutical industries, they have the various chemical drugs are in their pipeline, so they can provide us for the better identification or better their own metabolic profiles, and also the research communities like scientist, professor, academician, they can also use this particular tools and the methods through the Metabopsy, and also like government agencies like drug abuse, toxicity, forensic applications. There is also a scope of this NEL Metabopsy. Almost all the age, starting from the newborn baby till the age of till the death, the NEL Metabopsy have applications and can be suitably applicable to these range of individuals, right? Then the revenue model, it's not definitely any startup idea that should have sustainable, self-generating revenues, right? So our own this NEL Metabopsy, what we propose here, so that cost per sample will be of around 5,000, and the charges, and then benefit and long-term revenue, we plan that at least 1,000 samples or individual NEL clippings, if we can go for the NEL Metabopsy, and once the data will be generated, those data will be useful to the individual, to the society, to the government agencies, to the social even networking site, to create a sustainable, healthy environment among the population on this particular earth. Yeah. Already we discussed the NEL Metabopsy has wide domain. Revenues, what we are expecting from the multiple dimension, including research, pharmaceutical industries, if you look at here, definitely healthy and disease condition. Then also the government agency, they have like forensic applications, etc. Definitely, as a part of growth plan, it's a startup, it needs sensitization, awareness, advertisement, and that is why we are planning to go for like all these social networking sites for the advertisement, a website that is in picture, that is www.nelmetabopsy.com, and like all the government agencies, we have to bring together multiple stakeholders, including municipal corporation, hospitals, school, colleges, communities, and many more. And one more last thing is growth plan. NEL Metabopsy is going to be extended in future in the form of urine metabopsy, saliva metabopsy, serum metabopsy, based on what tools we have, what technology we have for the diagnosis and various other benefit to the human subject. And here is the SWOT analysis. What strength we have? The strength we have, that is in the form of our own in-house scientifically robust and acceptable technology. What we have, it's new, it aligns with the national and international health needs, including government agency or WHO and many more, and no issue of conflict of interest with existing biopsies. Or one more important point is NEL Metabopsy is not denying the importance of the existing biopsy approach or diagnostic approach. Instead of, NEL Metabopsy is going to work in addition as a complementary to the existing routine biopsy, so that better health environment, better health digital card or the resources can be generated. Opportunities, yes, it's a startup, so we have opportunities, that is, it is less expensive, less complicated, right? But there is also weaknesses. And what is the weaknesses? Right now, we have the less human resources, competitiveness to the existing diagnostic industries, because we have to convince the stakeholders. We have to convince the participant. We have to convince the agencies, and that is why startup will take time to create a awareness, to create a sensitization, to create competitiveness with other existing company. What are the threats here? Threats are lack of awareness among the customers. Initially, lack of awareness may be, oh, what advantage I will get if I will go through the nail metabopsy? What the uniqueness will be there? Because the customer, they have to think in a productive way, right? If they are going to pay 5,000 of rupees for the routine nail metabopsy checkup, what benefit they are going to get? And that is also, and also the from the government agencies, from the police department, their willingness to accept it, their willingness to participate, that may be also one of the issues. And that's what we can resolve it by sensitization, by awareness, by convincing that this method will have application for the safety, for the benefit, for all the stakeholders, either individuals or the society or the government agency, and many more. And based on all these, what we conclude here, nail metabopsy is a startup idea,
and it touches upon the individual, society, and up to the social networking site. Everywhere this data is going to get interconnected, and if it is going to be possible, that will help society at large. Okay, and the last point is that definitely the whole idea, I'm a professor here, Dr. D.Y. Patil Vidyapeeth, Pune, and I'm thankful to Honorable Chancellor P.D. Patil sir, Honorable Vice Chancellor Professor N.J. Pawar sir, Honorable Trustee Dr. Ismita Jadhav Madam, Honorable Trustees Dr. Somnath Patil sir, and all honorable authorities for generous funding, seed grant, and also a commendable working environment where as a professor, we can think for the betterment of the society in the health industries, and like in the form of nail metabopsy. And also we appreciate the efforts from the DPU Incubation Center, facilitation, etc. And we're also thankful to Professor J.K. Pal sir, Director of our institute, Honorable Ramesh Monde sir, Director Research, and many more. And definitely free access to the research facilities. That is also important to be acknowledged here, like Central Research Facility at DPU Pune, DYPVI, our own institute, and last but not the least, it is very, very important to acknowledge here the contribution of all UG, PG, and PhD students since 3 to 4 years. They have accepted the idea. They have accepted, initially very crude or raw idea to create such an approach so that we can go beyond what we can imagine. That is now in the form of nail metabopsies. So the students are my heartfelt appreciation to all of them. And again, thank you very much for attention, because most of the innovations are mostly unnoticed. And once we are able to notice, then it goes to the benefit of the society and the individuals. Thank you very much.